The San Francisco Health Department urging people to get vaccinated against the flu. On Monday, the department received its first reported death from the flu of the season. KRON 4's Tiffany Justice has the update now. She joins us now live from the newsroom. Thanks for joining us.
Everyone, that flu can be a serious illness.
The San Francisco Health Department reporting the first flu death of the season Monday, saying even though we are in the middle of the flu season, it's not too late to vaccinate. The person who passed away was under 65, we're told, with pre-existing health conditions and did not get this year's flu shot.
So we are in the middle of, the traditional flu season. What's been a little bit different here in San Francisco for this flu season is that it has not necessarily done a huge sharp increase that we might expect or we might have seen in prior years.
Dr. Hahn says we are not out of the woods yet, and that spike might come later in the season, which spans from November through March and April. The California Department of Health in their weekly report says influenza activity is elevated in the state and that now is a good time to get your flu shot.
The flu death that we recently had was someone who wasn't necessarily older, but they did have other chronic medical conditions. And these are really common medical conditions so you might not think that you might be at particular risk. So that's why the CDC recommends that everyone over the age of 6 months just goes out and gets the flu shot.
Those higher at risk for flu complications include adults with certain health conditions like asthma, heart disease, and diabetes. Those 65 years and older, along with pregnant people. Dr. Hahn says symptoms between flu and COVID can be very similar.
It is difficult to tell the difference by symptoms alone between COVID, flu, and common symptoms include things like fever and cough and feeling bad. But there's a whole bunch of other symptoms that you can get that are in common with the different viruses. So really the best way to tell what you have is to take a test.
Now the doctor says to get tested for COVID, it has gotten quite simple with those at-home rapid tests. But for the flu, those don't exist. He says if you think you have the flu and are worried, it would be a good idea to make an appointment with your doctor. Reporting in the newsroom, Tiffany Justice, back to you.
Tiffany, thank you. It is now taking longer to get the results from your at-home COVID test if you're positive. This is happening amid a winter surge of cases. So if you're positive, health experts say the results might not show up until the 4th day after you start experiencing symptoms. So people used to test positive for COVID-19 on a home rapid test 1 or 2 days after the onset of symptoms. Dr. Elizabeth Hudson from Kaiser Permanente told the LA Times that this lag is likely due to people having immunity that's accumulated over the years. She warns that negative test results could give a false sense of security. So if you feel sick, you should probably stay home and avoid contact with other people.